Hello, my name is Madelyn Danner. I'm a nurse with University of Maryland, Upper Chesapeake Health, and I'd like to talk to you for a few minutes today about safely taking your medication. As a nurse for more years than I'm going to admit to, I have seen many people who are not taking their medications correctly, and I'd like to help you not have complications because you're doing that as well. So what should you know about your medications? You need to know the name of it. Now, I know some of those can be very hard to pronounce. If you can get close, we'll figure it out. What is the medication used for? Why are you taking it? Many medications have multiple purposes. So it's helpful, for example, for us to know you're taking this medicine for nerve pain, not because you have seizure activity. Okay. What's the correct dose you're taking? Medicines come in multiple strengths. What time should you take your medication? Some must be taken in the morning, some must be taken in the evening. A lot of them it doesn't matter, but what time do you take your medicine? The correct way to take your medicine. For example, many people are on inhalers to help their breathing, and I see them take their multiple puffs back to back on top of each other instead of pausing in between as they should. Or perhaps the pill is hard to swallow and so they cut it in half. Yet there are medicines that you can damage the effect of the medications by cutting the pill in half. So how should you take it correctly? You should know about possible side effects of the medication, the nuisance side effects as I call them, and the ones that could be more serious that you should alert your doctor to. And we're going to talk more about that on an upcoming slide. And then, are there any special instructions with your medication? For example, should you check your pulse before you take this medicine because it can cause a slow heartbeat? So knowing these things about your medications can help prevent you from having a medicine complication, but also, especially knowing the name of your medications, helps healthcare providers trying to help you. If you can tell me as an emergency room nurse that you take metoprolol for your blood pressure, if you come to the emergency room with a very slow heart rate, then I know to consider that this is a medication reaction and not a more serious heart problem. So do be knowledgeable about the names of your medications, please. That will help you and help us. Okay. Many people end up in the hospital because they forget to take their medications. So having a routine for how you're going to take your medications every day is really important. You can buy a pill organizer at the pharmacy. You could also make your own, as I did, from an egg carton. Nice and cheap. Egg cartons you can write on. I wrote the times that I would take the medication in marker on the carton, and I fill it every day. When the bin is empty, I know I remembered to take it. Consider using one of those pre-packaging services like you may have seen on TV where they put all your pills in a little packet with the time on it. It's not just the commercials on TV. Your common pharmacies like CVS and Walgreens also provide this service at no cost to you if you ask. So consider that. Another bonus to those little packages is that they're portable. So if you're going out to lunch or dinner and you're supposed to take a pill at lunch or dinner, you got the packet right there with you instead of taking a medicine bottle. Okay. There are multiple devices out there, and please, I'm not recommending any one device. I'm just trying to make you aware of the options out there. To the far right, bottom right of the screen, you see a homemade something somebody did on their computer screen where they can list their medicines and the time of day they're to take them, and then they can X off the box when they took it. You can certainly do the same thing on a calendar. The middle shows a pill box. Now this is a fancy pill box because it actually alarms when it's time for you to take your medicine so that you can't forget. And on the far left, you see a watch that alarms. Now, certainly you can set your phone alarm, you can set your watch alarm. The important point is that you have some kind of cue to help you remember, oops, it's time to take my medicine, and a way to validate you took it, such as marking it off on a calendar. Okay. When you take your medicine, I've taken care of multiple people who are in the hospital because they got their pills mixed up and they were doubling up on one pill and not taking another. So make sure you can see the medicine labels well. Ask the pharmacy for a large print label. Use a magnifying glass. Have good lighting in the area. Just make sure you can see which pill you're pouring into your pill organizer or pouring out to take. When you swallow your pills, you want to swallow with your chin tucked to your chest. Don't do what that guy in the top left corner is doing, throwing your head back, which many people do. It kind of seems like that should be right. You throw your head back and then you got a straight tube down to your stomach, but actually you're doing just the reverse. When you put your head straight back, you're opening up your airway. So it increases the chances that you are going to get a pill or water into your lungs. When you tuck your chin to your chest, as you see in that diagram on the right, you actually kind of narrow the airway a little bit and open up the tube that goes to your stomach. So it's going to go down where it's supposed to go. Make sure you take all of the medication. This is especially important with antibiotics. It's human nature to say, oh, I feel better. I think I'll stop taking this. It makes me a little nauseated anyway. I'll put it away for the next time I get bronchitis. Don't do that. When you do that, the germs are really smart. They're not all gone. There might be some of them killed off, and that's why you feel better, but they're not all gone. So what happens is those germs get really smart, and they find a workaround to that medication. So when you get sick again, that medication is no longer effective. You may have heard of it. It's called antibiotic resistance. So it's really important to take the whole prescription. You shouldn't stop any of your medications without letting your doctor know. Okay. You may be having a side effect that is really intolerable to you and you don't want to take that medicine anymore. That's okay, but you need to let your doctor know. Many medications have to be tapered off. They cannot be stopped suddenly or they will cause serious health problems. Or perhaps you shouldn't stop the medication suddenly because being without that medication can be dangerous for you. So please don't stop any medication without telling your provider first. And by provider, that can be your doctor, your nurse practitioner. I'm using provider as a generic term for whoever wrote the prescription. Dispose of your medications properly. You stop taking medication. The doctor discontinued this particular medicine. Okay. Don't save it up. Don't give it to your friends. You don't know anything about their health history to know if it's safe for them to take it. If you save it, you may not remember that this medicine has been recalled and that it's unsafe to take. You need to dispose of it properly. So how do you do that? You put it in coffee grounds. You put it in kitty litter, then you put it in a sealed plastic bag and dispose of it in the trash. We don't want it going down the sink or the toilet where it goes into the public water supply. Okay. There is a correct way to store your medications. First of all, keep them in their original labeled containers. That sounds obvious, but I can tell you from experience that many people don't do that. Having those original containers, again, can help healthcare providers better take care of you. Okay. Safe storage recommendations. Some medications have to be stored in the dark. For example, your nitroglycerin pills for your heart. Unfortunately, many medications have become drugs of abuse, and that's not just pain pills. Nerve pills, anxiety pills, even common cold products have been used or abused by many people. So you want to keep those drugs out of sight, out of mind. If you have a person in your family that you suspect of abuse, consider even locking them up. And of course, you want to keep them out of reach of the children or the grandchildren who will look at those pretty little pills and think they're candy. Okay. This might surprise you. You don't want to keep your medicines in the bathroom or in the bathroom cabinet. I know I have a medication I have to take as soon as I get up in the morning, and it seems easy to keep it in the bathroom. but the humidity and heat from showering can actually degrade the medication and make it less effective. So the bathroom is not considered a good place for your medication. So after the bathroom, the next place I go is the coffee pot, so that's where I keep my morning medication. There are some things that you need to discuss with your healthcare provider about your medication. You want to ask, what should you do if you forget a dose? Don't automatically just double up on the pill. That could be dangerous for you. Very often they may have you do what we call slide the doses. Take it now, and then they'll give you a time frame for taking it, say 6 hours later or 8 hours later, something like that. But don't just double up automatically. If you're scheduled for a procedure, any kind of procedure, ask what to do about your medications. Many doctors will say, just take your heart pills with a sip of water, and they may not think about other important pills that you are on. For a person with Parkinson's disease to go 24 hours without their Parkinson's meds, that is really going to set them back. As will those of you with rheumatoid arthritis or other chronic conditions. You can't be without your meds for a long period of time. So ask them if it's okay to take your essential medications with a sip of water. They've gotten much more liberal with allowing people to drink a little bit before a procedure, so please ask about that. I know it can be embarrassing, but if you're having trouble affording your medication, you also need to talk about that with your healthcare provider. Okay? There may be a less expensive alternative. There are resources out there to help you get the medication that you need. But don't say yes, doctor, or yes, nurse, and take the prescription and never fill it, because they're going to think you're taking it. And when you're still having health problems, they're going to assume the medicine isn't working and then add more medication to it. So I know it's difficult, but please bring up that discussion if you can't afford your medication. We certainly don't want you to buy your medication and not eat either. So have that conversation. It is good practice on a regular basis, at least once a year, to bring a medicine list with you and review it with your doctor. It's a good practice to have a medicine list, period. Have it on your person, but to review it with your doctor is very important. And this is really important if you have multiple doctors prescribing medication for you. Your heart doctor, your diabetes doctor, your kidney doctor, your lung doctor. I'm sorry to say, many doctors, most doctors, don't look to see what the other one ordered until there's a problem. So you want to advocate for yourself by keeping that list of all your medications and reviewing it with your primary care provider. By reviewing it regularly, they can identify if there's duplicate medications on there, if there are unnecessary medications on there, if there might be less expensive versions of medications you can take. All of those can help to prevent complications for you, as well as help to save you some money. Carrying a list of medications with you is also very valuable to have, again, if you are having to have care by emergency providers. If you would be in a position where you're not able to talk to us, we can look at that list of medications and have a real good idea of your health history from what medicines you're on and more safely take care of you. So do think about keeping a list in your wallet or your purse. Also, you need to talk with your pharmacist. You want a relationship with a pharmacist just like you have a relationship with your healthcare provider. This is especially important, again, if you are having medications prescribed by multiple doctors. Ideally, get your medicines from the same pharmacy so that they have a complete list of all the medications that you're on. They have programs that they can run these medications through that will look for complications, interactions where it could affect one drug effect against another drug, which drugs have similar complications that increase your risk for a serious side effect. So having the same pharmacist can really be another safety guard for you. When you get a new drug, take a minute to talk with the pharmacist. Yes, they give you the package insert that has way too much information in it and really small print. So talk with your pharmacist to get the key points that you should know, like special instructions for taking the medication. Do I take it in the evening? Do I take it whole? Okay. Or can I cut it? What are the common side effects to be aware of? Again, what are the nuisance side effects that are just annoying? What are the dangerous side effects that if I notice them, I should call my doctor right away? Okay. Are there any interactions between this new medication and the medicines I'm already on? And you want to talk to the pharmacist not just about those prescribed medications, but the ones that you pick up over the counter that don't need a prescription. There are many medications that interact with over-the-counter medications that interact with the medications that you may be prescribed. So it's a good practice if you do have health conditions, talk to your pharmacist before you try something new to make sure it isn't going to cause a problem for you. Just to give you a real-life example, many people pick up something like an ibuprofen to take for their arthritis. The ibuprofen can cause people to retain water, which makes your blood pressure go up, your ankles swell. Then your doctor thinks that you have a little heart failure. Now you've got a water pill to take when you were just trying to help the arthritis pain. So talk to your pharmacist and have a good relationship with them. So those are my tips for you on staying safe with your medication. I hope you found them helpful.